Okay, 30 seconds. You ready? You got 2 seconds. 20 seconds.
Put on my page, and I will be happy to answer the questions for you.
All right, I'm opening the mic. Quiet, everyone.
Hey, good evening, everybody. Welcome to another episode of Talking with Dr. Donna. Thank you so much for joining us. So excited to have you here tonight. As you know, this is my show, Talking with Dr. Donna. I am your host, Dr. Donna White Carey, and I thank you for tuning in with us tonight. If this is your first time tuning in, welcome. Thank you. You have an appointment with the doctor every Thursday at 6:30 p.m. Pacific Standard Time. If you are not already subscribed and you find that at the end of this show you've learned at least one thing, then for me, I would ask that to return the favor of having on this show and learning something, that you will go to my YouTube channel and you will subscribe. And then hit that bell icon right next to the subscription so that you know every time we go live. And again, we go live every Thursday at 6:30 p.m. This show is really built on revolutionize the way we look at health, particularly in the Black community. We are building a generational health network. And that means we're going to focus in on the 4 pillars of health. We're going to focus in on a spiritual pillar. We're going to focus in on our emotional and mental pillar. We're going to focus in on a physical health pillar, and lastly, our environmental health pillar. And why are we focusing in on these pillars? Because I believe that if we focus in on these 4 pillars intergenerationally, that means the generation that you're in, the generation above you, and the generation below you. But if we pay attention to the 4 pillars within these 4 pillars within each generation, we are going to end the cycle of premature death in the Black community. That's what I believe. That's what this show is based on. That's the framework by which we think and believe on this show. So, good evening, everyone. I see you. For those of you who, again, don't already follow me, these are my handles to follow me. You can go to @MyDrDonna on Facebook or Instagram, or Talking with TW Dr. Donna, also on Facebook, Instagram, and as well as Twitter. But let me know that you can go in and follow me and say hi. One second, food is here. You guys know Dr. Donna is also a mom, so I have to every once in a while do a little bit of mommy things, and my son's food has just arrived, so he has to go get it. So I apologize for that little break. Again, please follow me. Let me know that you're out here. We go live, so that means that if you're following me, you can use the chat function. You can talk to me. You can say hi, and then I will be able to interact with you. So I want to say good evening. Hey, good evening, Ryan. Good evening to Keith. Good evening, Sharice. Ken, what's up? Annette, Cynthia, hi. Thanks so much for watching out there. It's going to be a good show tonight, really, despite the motherhood influence here and a little bit of a break. It's going to be a great show, so stay in with us. This is also Women's History Month, so we cannot just let this month pass by without saying hi and thank you to all the women out there. And I want to give a special shout out to all of the mothers out there tonight who have continued to hold it down for their families, continuing to do all of the things that you do to help not just you thrive, but your families thrive and your children thrive. So shout out to all the mothers out there, and whether or not you birthed a child or adopted a child or foster a child, or help a neighbor's child, you are all part of the village, and I want to give a shout out to you tonight and thank you in advance for what you're doing and what you are going to continue to do. So happy Women's History Month. Thank you, Kimberly. Happy Women's History Month. This is also Colorectal Cancer Awareness Month. March is a lot of things. So that is the focus of the show that we're going to talk about tonight, colorectal cancer. And why are we going to talk about colorectal cancer? We're going to talk about colorectal cancer because it is the third leading cause of death in the Black community from cancer. Okay, we've talked many times before about causes of death in the Black community, and cancer usually between men and women is that number 3 cause, and it's the number 3 cause of death in the African American community. The number of Black people who have colorectal cancer is about 20% more than the number of whites who have colorectal cancer. And the survival rate of colorectal cancer is 5-year rate is about 67%. But of course, when you find it, the earlier you find it, then the better chances that you have. So that's why we're talking about awareness tonight. And we're not talking about treatment, or we're talking about awareness, because it's really important that you understand that this is something that you need to pay attention to. If it's caught early, then you do well. And obviously, like any disease, if it advances or goes too far, then it can be too late by the time you discover that you have cancer. That is why colorectal cancer is actually called the silent cancer killer. And here's 5 bonus points for you. There's another silent killer that we talk about in our community that impacts us significantly. And if someone puts it in the chat, I'm going to give you a little prize. What is the other silent killer that we talk about that impacts the African American community? First person who gets it on there, I got a little prize for you tonight. Okay, so are we good with Dr. Rhodes? Yes?
No.
Yes? Okay. All right. So let's go ahead and talk about some of the symptoms of colon cancer. Okay? We have a guest tonight, and we're having a little bit of technical difficulties, but we're going to get her on, and you are, trust me, she is going to be worth the wait. The conversation is going to be worth the wait. So please bear with us while we get through some of our technical difficulties. But let's talk a little bit about colon cancer and what is the symptoms of colon cancer. How do you know if you have colon cancer? So if you have dark stools, bleeding, particularly if you see blood after you have a stool, in the toilet stool, right? We can talk about poop tonight, right? If you have bloating, right? So sometimes your stomach may feel full. You might have gas, abdominal distension, or your stomach kind of poking out, looking a little bit bigger than usual. Anemia is also a big sign, particularly if you are a postmenopausal woman. What does that mean? That means you've already stopped having your cycles, but you're still anemic. That shouldn't be occurring, right? If you're anemic and you're older, then there might be something else going on, and that might be that you're losing blood somewhere, and sometimes that blood that you're losing is blood that you're losing in the stool. And you might also have a change in your bowel habits. And so these are some of the symptoms. Now, this is why this is so difficult, is because if you look at these symptoms, you see these symptoms can be anything, right? Anything can cause bloating, or anything can cause your stomach to feel a little bit full. You can have weight loss, particularly if you're trying, and you can have some changes in your bowel movements based on what you're eating. So one of the difficulties is that how do you know that there's something different going on versus and something that you really need to pay attention to, and something that just might be a part of growing older. So that's why it's important to see your doctor, and we're going to talk a little bit more about seeing your doctor. and the importance of seeing your doctor in a little bit. Okay, so I see that Dr. Rhodes is ready. Yes? All right. So let's bring on our guest, Dr. Kim Rhodes. Come on, Dr. Kim, let's bring her on. Dr. Rhodes. Hi, Dr. Rhodes. I don't hear Dr. Rhodes.
I said, hi, Dr. Donna, how are you?
Oh, yay!
We have contact.
We have contact. It's always so good to see you. It's so good to see you. Thank you for being on tonight. And Dr. Rhodes is highly accomplished physician. I'm going to attempt to shorten down your tremendous bio because I want people to know exactly who you are. She is associate professor at UCSF, or the University of California, San Francisco, in biostatistics and epidemiology. She's also the director of the Comprehensive Cancer Center at UCSF. She is also a surgeon by training. She is a colorectal cancer surgeon by training. She is the founder. We've had her on before, but wearing a different hat. She's the founder of Umoja Health, and who has been really instrumental and tremendous in the Alameda County around the response to coronavirus, getting folks vaccinated, tested, and she is just a wonderful, wonderful person, a dear friend, and she's just someone that we wanted to bring on tonight because she is doing a campaign around colorectal cancer awareness, and we want to kind of talk a little bit tonight about colorectal cancer awareness, but also some of the things that we've been talking about around coronavirus, post-coronavirus, and things that we think are going to impact you out there that are listening. So I want you to welcome Dr. Rhodes to the Talking with Dr. Donna. Thank you again for being here.
Thanks for inviting me.
Of course. So let's get right into it. There's a couple of things that are in your bio of who you are that I just want to highlight and have you explain what it is so that folks can really know what you do. So biostatistics and epidemiology, not things that a lot of people are aware of exactly what that is and what someone might do who has that training. So can you tell a little bit about the biostatistics and epidemiology? What is that?
Sure. So epidemiology is the study of disease and the distribution of disease in population. So you're really looking at big numbers and looking at defined communities. So you could say you're looking at age, or you're looking at a particular distribution of disease by race, ethnicity. You could look at social factors like neighborhood, resources that are available. So it's really the study of the distribution of disease in populations. And with that skill set, what I do is I ask questions about the quality of care that African American people receive in California. So using all of the data that gets generated by someone going to the hospital, we can ask questions like, did people get appropriate care? And does that have an impact on outcomes? And so I've been researching that question for more than 10 years, asking the question of whether or not the disparities we see in different kinds of cancers for African American people are a result of the quality of care that is delivered in California hospitals.
Great, thank you. And what have you been finding?
Well, I mean, it's funny because I don't think the findings are a surprise, but what is surprising is that people hadn't asked the questions before. So I started writing about this in 2006. And specifically asking the question if the quality of the hospital had an impact on survival, regardless of the kind of insurance that somebody had, and regardless of their comorbidities. And what we know in California is that if you don't get coordinated care where each of the different steps, specifically for colorectal cancer, that are necessary, if those steps don't get knitted together, then people have worse outcomes. And what we did show was that if people got the care that is appropriate for the stage of disease that they have, that the disparities gap would actually close. And then shortly after that, we found the same thing in acute myelogenous leukemia. And I've written several papers with colleagues on liver cancer and pancreas cancer with similar findings.
Wow, that's pretty amazing. So thinking about that, like what is like one tip that you might give the folks that are listening tonight about that, about making sure that you're getting care that's appropriate to your level of illness or disease? How do they even know? I mean, a layperson wouldn't know if that is something that is missing. So anything that you found in your research or studies that you can share tonight to kind of help people?
Well, one thing I would recommend is that people either get educated or pair up with an advocate, and folks like you doing the work that you're doing, providing guidance to people. There is no consumer reports for the hospitals, and there really should be, where you could look up, like, if I have this disease, which hospitals are the best in terms of have the best outcomes or provide the friendliest service or whatever. But there are no guides like that. So I would say if you're diagnosed with a cancer, the questions I would be asking, specifically if you require surgery, I would be asking the surgeon, how many of these do you see in a year? Is this something you do, as a specialty? And getting a sense of what the experience is, because we do know that high volume hospitals that do a lot of particular kinds, tend to have better outcomes for those operations.
Yeah, thank you.
That's where I would start.
Yeah, no, that's a great question. Asking, is this something that you do a lot? And if someone says, oh, I probably see 2 or 3 a year, that may not be the person that you want operating on you and taking care of you, right? You kind of want somebody who's in the hundreds.
Yeah, you don't want to be number 3.
Yeah, yeah, you do not want to be number 3. So thank you for explaining biostatistics and epidemiology. And I think it's important because a lot of times in our community, we're pretty hesitant to give out our information and to talk about what's going on in our health. But I hope that you're hearing tonight that this is important, because the more that you share, then people like Dr. Rhodes can actually take that information and really run with it, right? And we can see what are the issues that are really impacting our community, what's really helping our community. And so it's important that we talk to you all, and it's important that you talk back to us. So that's why I really wanted to stress that there's people out there that are asking these questions, not just because we're nosy, but we're really asking them to really bring that back to help you all in the community. So next time you get a phone call and they ask a survey and they're not asking for your social security number or anything like that, and it's legit, answer the phone and please answer the question. Okay, so I want to back up a little bit, Dr. Rhodes, and come back to this colorectal cancer awareness campaign. But before we do that, I really want to talk about what is cancer. And we talk a lot and we say cancer, and we have many different types of cancer, but I really want people to understand, what does it mean? What's going on in your body when they say that you have cancer? Can you explain what is cancer?
Sure. I think most people think cancer is a tumor, but it doesn't have to be a tumor. Cancer is, the way I would think about it is comparing it to what it is not. Okay, so cells in your body look kind of like a fried egg, with the yolk part is the nucleus. That's where all the important stuff is. That's where the messages about what to create and how to make structure and protein to form the cell itself, that's where the important stuff is. But with what happens in cancer is, like, if you imagine in normal tissue, you have one fried egg next to another fried egg next to another fried egg, and they can never heap up on each other because there's signals that say, once you touch the next cell, don't grow any further. The problem with cancer is the cells become disorganized. So the nucleus, instead of being in the middle like a nice fried egg, the nucleus is off to the side in this one. And in this one, it's like up at the top at 12 o'clock. So the cells start to not look like each other. And they lose their ability to respond to the signal that says stop growing. So when they touch each other, instead of stopping, they continue to grow. And that what allows them to heap up, and that's what we understand as tumors in solid tumor cancers. In blood tumor cancers, it's the cells that are circulating in the blood that are abnormal, and they're overproducing themselves. So it's basically an overgrowth of cells that have become abnormal in such a way that they lose their ability to know when to stop, even when they're being told, you're supposed to stop now. They don't know how to stop growing.
Right. And I think there's a slide on that, if we can find the slide on cancer that looks at the pictures, because I think it's great when you hear it, but sometimes a picture is worth 1,000 words.
Absolutely.
Of what is cancer. So just like Dr. Rhodes was just explaining there, at the top, those green, that's normal, healthy cells. And then, as Dr. Rhodes demonstrated, that and talking about that red in the center is sort of the things that are sort of damaged off to the side. And normally in your body, those cells get destroyed. But when those cells don't get destroyed, they start to continue to mutate and change, and then they overgrow, and that's what causes cancer. So that's a pictorial of what Dr. Rhodes so beautifully explained. So thank you. Now let's talk about the colorectal cancer campaign that you're working on. Tell us about that.
Sure. So I actually borrowed this idea from a colleague of mine at USC, and she has the same job I have, and I just did want to clarify that, because yes, while it would be wonderful if I were the chair of the cancer center at UCSF. I am currently not that, but I am that's okay. But I am the director for the associate director for community engagement, and then the director of the Office of Community Engagement for the UCSF Cancer Center, which means that I have to work in community and engage communities from Mendocino County all the way south to Monterey, so 25 counties.
Wow.
Of partnerships. Yeah. So a colleague of mine who has a similar job at USC put together over a number of years, she did it every year, this is the first time we're trying it, a huge visual campaign so that around the city, wherever you were, whether it was at Safeway or at the corner store, there was some messaging to remind people to get screened for breast cancer. And by doing that year over year, she actually, and for me, this is like, these are the real rewards. She saw an impact on the Latina community, which she focuses on, in terms of the stage of breast cancer when it was diagnosed over the period of those years where she was working went down. So women were getting diagnosed early. That's how you can have a real impact on survival, is by attacking at a level that it impacts the whole community. So what we're trying to do is a visual campaign for colorectal cancer awareness, because this is one of the few cancers that is actually preventable if detected before it transforms into cancer, and highly treatable and very beatable. And so we wanted to start to encourage people to get screened. And although I'm affiliated with UCSF, we are agnostic to where people get screened. If if you don't live nearby UCSF, or you're not a UCSF patient, that is really not important, because when we're trying to impact population, we can't be paying attention to the business aspect of healthcare. So It's not a competition, it's an opportunity to work together in the spirit of Umoja, in order to help our communities get screened. And as you may know, there are disparities in survival from colorectal cancer for African American people. And so I feel like if we can lift up the screening rates and encourage people all around, then we could actually start to see an impact on survival for our people. But it means we have to do it year over year. So we'll be having events where we're providing COVID services, testing, and vaccine as usual, but we'll also be handing out colorectal cancer screening cards. They're called FIT, or fecal immunohistochemical test cards, where people can conduct their own colorectal cancer screening. We will also provide supports to get those tests submitted and mailed in. And then I will be receiving the results with my Umoja team, transforming them into, instead of calling about COVID, they'll be calling about colorectal cancer screening. And in that way, really getting people educated, but also taking the action to get them screened. And if they're positive, to help them get linked into the next steps in care.
Right, great. And for those of you who did not watch my episode last week where we talked with Dr. Peterson, who is a GI specialist here in Oakland, and we went through the various screenings. We went through when you should get a FIT test, right, and when you should get a colonoscopy. So we're not going to repeat all of that this week because we did a great show. So watch my last episode last week with Dr. Peterson to get all the information about screening, when you should screen, and why you should screen. So that's great. I think it's important in our community that we just continue to talk about prevention, right? So often in our community, we really focus in on now you have the disease, how do we treat it? And really appreciate that we're trying to really start it at the beginning, preventing the disease from happening in the first place. And one of the ways of prevention, of course, is by screening. So we're looking forward to seeing the big intestine around the city.
It's the inflatable colon.
An inflatable colon.
Yeah. we
So
will
can
be
we
showing.
walk through?
Yes. So the inflatable colon is one of my prized possessions in my Office of Community Engagement. I think it's a great teaching tool. The kids love it. They always run to it. Then that brings their parents. It is about 10 feet high and 12 feet long. And it has things you can touch. It's very tactile. So there are polyps. So you can get an idea of what the beginning of a colorectal cancer, how it starts, which you probably covered in your last session. And then all the way to the progression of the polyp becomes malignant or cancerous, to a cancer develops, to an advanced cancer. And so we'll be willing to walk people through that and talk about the screening guidelines, and we'll do a little screening. And if you're eligible to be screened by, then we'll actually provide the test kit. We'll also be handing out flyers that include some FAQs so that people have some basic information about colorectal cancer that they can share with their loved ones. And we also have some information on the back of those cards, like QR codes, that people can look up their own additional information.
Awesome. Is there something online that people can go to find out the schedule or when they can participate in the and walk through the inflatable colon?
So we do have our schedule up on our website for Umoja at United in Health Oakland, all one word, .org. United, that's www.unitedinhealthoakland.org. We just are transforming that website, which is usually focused on COVID, to an emphasis on colorectal cancer awareness. Anywhere we're going to be in our usual, our typical locations for testing and vaccination, except for the high schools, we will be providing colorectal cancer awareness information for here through the rest of March, from here until.
Awesome. Great. So does that include us? Are we going to get the inflatable colon?
Well, we also have a partnership link that I'll have to see if I can share it somehow in the chat that allows people to sign up. We do have a number of churches both in San Francisco and in Alameda County who are going to be participating in the campaign or hosting their own events. We are also willing to provide the collateral and also provide some fit kits with our the process of signing people up, so that if folks want to do that and not necessarily have the COVID services at the same time, then we're going to support our community partners to do that on their own. But the great part about it is the results still come back centrally to us, so we're not going to lose anybody in the process.
Great. That's great news. And just as a reminder, folks, we're live, which means if you have a question for Dr. Rhodes, you can put it in the chat. And I'm monitoring the chat and seeing a couple of questions have already come up. Lots of accolades and appreciation for you, Dr. Rhodes. But so you're talking a part of what you do with Umoja is testing for coronavirus as well as vaccinations. we've talked a lot on this show about the importance of getting vaccinated, and the importance of the prevention piece, again, of getting coronavirus. But we know that now lots of people are saying that we're kind of beyond that stage. And so I want to give you an opportunity to talk about what you think, where we are in coronavirus. And do you agree that we are beyond the stages of needing to worry?
I don't think we are done with coronavirus. I don't think coronavirus is done with us, and I think we need to be cautious. The past 2 years has been a repeating cycle. So if you go back and you look at the pattern of the surges, they start around the same time, they end around the same time. And I think so far, because we've been through 2 years of it, we think that we're the reason that that the surge comes down. Like in January 2021, we all got vaccinated, surge came down. We thought, oh, it's because of vaccines. I think the virus has its own pattern, because then we saw it again in January of 2022. But I think the important point for people to understand is that even though the virus has its own pattern, the fact that we got vaccinated, so many people in between January 2021 and January 2022, meant that even though we had so many cases in January 2022, we had so many fewer relative deaths. And so the one thing that we know is protective right now is to get vaccinated. So I want to just really recommend that people not only get the 2 doses, but get the booster if you're eligible. That's what we have right now that we know works the best. The treatments are really, really difficult to get. I'll just give the number in San Francisco, when the Emoja Network in San Francisco was alerted that Paxlovid, which is the antiviral treatment, was going to be provided and available to us and those who are serving on the ground, was 50 doses, 50 doses. There are 1 million people in San Francisco, and it's because the medication itself is in shortage. So you can't really rely on this idea that you're going to take medication if you get it. I think we need to try to prevent it. And we know that vaccines do prevent transmission, not for everybody, but when you compare to unvaccinated, it's about 2 or 3 times more protective if you're vaccinated, prevent getting COVID. Now, when we're talking about deaths right now, deaths have been up to 20 times higher in unvaccinated populations versus vaccinated populations. So the vaccine does really make a difference. And so I just want to continue to endorse that. And if you're not getting vaccinated, I also understand that people have their reasons for that. Please, please wear a high quality mask and protect yourself and others.
That's great. Yeah. So we definitely, lots of folks are saying yes to what you're saying, and we've definitely, are aligned in that thought pattern of making sure that you all know that we're not finished with COVID. So there's a couple of questions, Dr. Rhodes. I'm going to see if you don't mind taking a few questions. One question is there any research on COVID and the digestive system or the colon, how it might impact?
Well, I don't know if there is clear molecular evidence of COVID impacting the colon, but we do know that people do get a GI version of COVID that includes a lot of nausea and vomiting, a lot of watery diarrhea, and severe dehydration. But what I will say, even though we don't know why it looks like that in some people and why it looks more like a respiratory or a pneumonia type illness in other people, but coronavirus attacks whichever cells happen to have the right receptor. And that's because the receptor is like a lock, and coronavirus has a spike protein. It's like a key, and it's opening up the cell. And that particular lock is present all over your body through your blood vessels. So any organ can be impacted by coronavirus, because even though we talk about it like it's a type of pneumonia, it really is a inflammatory disease of the blood vessels. And that's why we see people having strokes and getting blood clots and having kidney failure, and even COVID toes. That's related to the blood vessels being infected by coronavirus. So yes, there is a GI version of COVID.
All right. Thank you. Another question. If you remove polyps, first of all, do all polyps, having a polyp in your colon means that that's a precursor to cancer? And if you remove the polyps, are you preventing colon cancer?
Great questions. So there are a couple different types of polyps. There are what are called adenomatous polyps, and those typically are going to turn into cancer if you just leave them for a while. And I want people to understand it takes about 10 years to grow a cancer, like to grow the full tumor that can be seen and is not normal colon cells. It's just completely replaced by tumor cells. So it takes a long time. Adenomatous polyps, if left alone, will turn into cancer. Hyperplastic polyps, on the other hand, that's just another name you might hear, those are not prone to turning into cancer. However, if removed, either one of them, yes, you are absolutely preventing cancer. Any abnormal growth can make a wrong turn, as you described, as the cells continue to divide. If they're already a little bit damaged, they can mutate further. And that's how you get into those abnormal looking cells that don't know how to stop growing, i.e. cancer. So yes, most people doing a colonoscopy will remove both what might look like a hyperplastic polyp as well as what looks like an adenomatous polyp. You won't know the final result until they look under the microscope to tell you exactly which kind of polyp it is.
Great. And here's a plug that is for a personal Dr. Donna plug, is that you need to know what you have. So if you go to the doctor and they tell you that you have a polyp, don't just assume, okay, all polyps are the same. Dr. Rhodes just told you there's 2 different types of polyps, and probably more than 2, right? There's a couple, and polyps from different reasons. So understand what you have. Of course, you may not be able to spell it, and maybe it's a super complicated word. Have your doctor spell it out for you, write it down, get reports. Now with in this age of computers and everything being on, in our medical records being on the computer, you can get a printout. Have them give you a printout so that you can then put that in a file and put it away, so that if something else comes up, you'd be able to really tell exactly what you had.
Great
Okay. All right, let's see. I thought I saw another question for Dr. Rhodes. I'm looking here. All right, I think
I see Judy is
Yes.
asking, does
Oh,
COVID
yes.
have an effect on memory?
Thank you. I knew I saw another question. Yes.
Yeah, raises a great point about what we're calling long COVID. It's also called post-acute syndrome of coronavirus.
I think that's it.
PASC.
Yeah.
We call it long COVID.
Yes.
And it's basically residual symptoms anytime 6 to 9 months after you've recovered from COVID. And there's this increasing, as I mentioned, this is a vascular disease. So anywhere blood vessels go, COVID can go, the virus can go and cause inflammation. And so there is increasing evidence of loss of brain tissue in post-COVID states. So brain fog is one of the kind of key symptoms or signs of long COVID. So inability to concentrate or difficulty concentrating. I just recently read an article about testing where the timing of doing a task, right, is like doubled and tripled in some people who have this kind of brain fog. It's just that everything is sort of in slow motion. You can also have continued loss of taste and smell. There are just any number of different kinds of symptoms that you could be experiencing. Continued cough, difficulty breathing, that's very common.
Mm-hmm.
So yeah, there is evidence that it can have an impact on memory.
Yeah, and I was reading a statistic that said somewhere between 6 million and 36 million people are suffering from long COVID. That's a lot of folks out here who are having symptoms even after they are no longer infectious with coronavirus. So this is why we keep talking about the prevention piece, right? Because you don't want, we can't tell you, we can't predict if you're going to get COVID and completely get over it, or if you're going to get COVID and have a stroke, or you're going to get COVID and die. We cannot predict those things. And so what we can do is try to prevent you from getting COVID in the first place. And that's wearing your masks, getting vaccinated, and doing some distancing, even today, doing a little bit extra distancing. All right, so here's another question. Someone has stage 3 colon cancer. Should they continue to get colonoscopies as screenings or do the sort of FIT tests? Or does it matter?
So we usually reserve the FIT test for average risk. You probably talked about that last time. And average risk means no family history, no personal history of polyps, no personal history of inflammatory bowel disease. So generally speaking, with that family history, I would tend toward colonoscopy. One of the key features is to ask how old was the person when they were diagnosed with colorectal cancer. So if that person in your family, your father, your mother, your brother, your sister, so first degree relatives, they're directly related to you. If they're diagnosed at the age of 50, you should start your screening at 40. If they were diagnosed at 40, you should start your screening at 30, believe it or not. So that's an important point about family history. However, if they were 60 when they were diagnosed, that would have you screening when you're 50, but the new guideline is for everyone to screen at 45. So that just came out in the last, I think, 18 months. And so even if the person in your family was 60 and you think, well, I don't need to screen until I'm 50, actually, you need to be screened at 45. Everybody screen at 45, except those with a family history that tells them to screen at a different age.
Yeah. So again, knowing what's in your family, knowing your family history, and not just saying, oh, so-and-so died of cancer. Well, what type of cancer? Because, in our community, a lot of folks just don't pay attention to the specifics because maybe they didn't get the specifics or no one really explained to them what it was. So this is really important for you. So to know what type of cancer someone in your family has and the age at which they were diagnosed with that type of cancer can help you to determine your risk and age in which you should start your screening. So great. All right, so another question, if you've been tested, or actually you think you had COVID over a year ago, is there a test that you can take to determine if it was actually COVID because you never really tested, you just assumed that you had COVID? Is there something that we can test with now to determine if you had COVID a year prior?
Well, it depends. If you've been vaccinated, that might make it difficult because you will have mounted an antibody response to the vaccine. And so it will be unclear if that was from being vaccinated or from having had COVID. In the beginning of the pandemic, UCSF mounted a big effort to make testing available in the community. And so one of the things we did was not only testing for acute infection, but we also drew blood to test for antibodies. And we did that for several months until it started to become clear that there were people who knew that they had had COVID because they were hospitalized or they were tested for it, and the antibody tests were negative. So they were kind of unreliable. So we stopped actually using them. So it's not clear that we have a reliable test for antibodies right now that would tell you the difference between you've been vaccinated or you had COVID. And if it was a year ago, we don't have a reliable antibody test right now to tell you that those antibodies are to detect those antibodies. We also think that if you get COVID and you do mount an antibody response, that it doesn't last, but for about 90 days.
All right. You heard it. All right. Any other questions for Dr. Rhodes? All right. Dr. Rhodes, I'm going to give you your final recommendation or advice or comment that you would like to tell our audience about colorectal cancer this month or any activities.
I just want to repeat that this is one of the few cancers that we know how to prevent. So it is truly preventable, and it is treatable when found early. And with good care, it is absolutely beatable. Preventable, treatable, beatable. We want you to get screened if you're 45 or older. And remember that screening saves lives. And so we're out here just trying to save our people. And bring the care to where people are, meeting them where they are, and then providing whatever support is necessary to get you through that process. So I hope to see many of you on at any of our sites, at any of our locations. Come by and see the inflatable colon, pick up some collateral, share it with your congregations, share it with your neighbors, and let's get screened. Let's see if we can make a difference.
Yes, awesome. Well, thank you, Dr. Rose, for being on the show tonight, and thank you so much for everything that you do for the community and in the community, and I hope you get some rest tonight.
You too, Mom.
Yeah. Yes, thank you, Mom. We'll see you soon. Thank you, Dr.
All
Rose.
right. Take care now. Bye,
Thank
everybody.
you. All right, folks. So I hope that you took note of what Dr. Rose was saying. We're going to have a couple of things left that we have to do. Again, if you missed your appointment with the doctor last week, we had a great show with Dr. Peterson, who did a lot of conversations about the screening and the colonoscopy and when you should get what. So please make sure to tune in to the show from last week to bring it in for this week. Okay, let's talk about need to know. So this is Dr. Donna's need to knows. Okay, the first need to know is we're going to talk about screenings. Okay, so we've talked about the COVID, and we know that for the last couple of years we have been really focusing in on coronavirus, on the pandemic, making sure that you get vaccinated, making sure that you social distance. And a lot of our effort and focus and energy has been around coronavirus. Well, tonight I want to encourage you to now think about other parts of your health. And I know it's really important that you think about your screenings. So there's another slide, Donnell, that has multiple different screenings on there, and that's it right there. So if you can make that big and take me off screen, because I want everyone to be able to focus in on this screening, okay? So I want you to now take your time to schedule your screenings. If you are a woman, I want you to take the time to schedule your mammogram. Tomorrow, if you haven't already scheduled it and it's been a year or it's been 2 years, now's the time to schedule your mammogram. I also want you to schedule your screenings for your colonoscopy. If you are 45 years or older and you have not had a colonoscopy, you just heard from Dr. Kim Rhodes and from Dr. Ralph Peterson last week, who says that it's been updated. 45 years old is when it's recommended for you to get your colonoscopy. So if you were 45 and you were thinking you had 5 more years until you hit 50, no you don't. Now's the time to schedule your colonoscopy, okay? And it's really important that you think about these screenings. Also, think about your screenings for your children, right? Think about what your children need for their preventive health, making sure they're up to date with their vaccines, making sure they are being screened for lead at the appropriate age. So I want you now to start to focus in on screenings to start to help you get back to taking care of every single aspect of your health, okay? Screenings save lives. The earlier you find out, the better off you will be in terms of anything cancerous that they might find. For more information about when you should screen and what types of screenings are available, you can go right there to the website that's on this page, cancer.org, okay? Screening saves lives. Please get screened, okay? Dr. Donna's second need to know is about masks. Now, we've talked a lot about masking on this show, the different types of masks. the importance for you to have the right fit of your mask and the right filtration of your mask to make sure it prevents your disease from happening. And so now we've had an emergency where masks were mandatory. And now we have moved into a phase where masking is no longer mandatory, but is now strongly recommended. And so the mask mandate for outdoors is lifted. You don't have to wear a mask outdoors. And indoors is strongly recommended. So what does that mean, though, for you? That means for you that you need to really consider what your risk is. Are you a high risk? And if you are, then I would recommend that you continue to wear your mask. What is Dr. Donna going to do? Continue to wear her mask. So I'm going to continue to wear my mask. I wear it outdoors, even when I'm out exercising. I wear it, and I wear it indoors because, again, as Dr. Rose and I have been talking about, we don't want to even get COVID, right? Even if we think it's going to be mild. The Oakland Unified School District has not lifted the mandate for masks indoors just yet. So if your kids are in K through 12 in the OUSD system, they're still going to be wearing masks indoors at least for the next 2 weeks. So bravo to OUSD for not lifting that mandate just yet. But for the rest of us, it's strongly recommended, and I strongly recommend that you continue to wear your mask. COVID is not over. It is not gone. And nearly 2,000 people passed away from COVID just yesterday. So that is still a number of people who are getting infected and dying. And as I talked about in my Needs to Know a couple of weeks ago, there's a range in between. There's the getting the COVID, getting over it, getting well. There's then long COVID. There's getting COVID and then having some sort of disability because of that COVID, whether it's difficulty breathing, whether it's a stroke, whether it's now being on oxygen that you weren't on before, or now having diabetes that you didn't have before COVID, all the way up to death. So COVID has a long range. So this is why wearing a mask and the prevention is really, really important. The number 3 need to know for this week for Dr. Donna is today we're talking about screenings. And one of those screenings that I want you to pay attention to is HIV. March the 10th is National Young Women HIV and AIDS Awareness Day. So that is another screening that I want you to put on your list. If you are sexually active, you need to have an HIV test done annually. You need to know your numbers. There are over 1 million people that have been diagnosed with AIDS, and out of those people, almost a third of those people were not even aware that they had HIV. And they weren't aware because they didn't screen. So if you're sexually active, then you should be getting an HIV test on an annual basis. And add that to your list of things to screen for. Okay? So those are Dr. Donna's need to know for this week. Now, as you know, on this show, we've been focusing in on our diet because we want to do better. That's a part of our physical health pillar. What we eat, what we put into our bodies, and as well as how we exercise. So our food of the month for the month of March is, who knows it out there? Yes, it's broccoli. Broccoli is our food of the month. So I don't want you to just eat the foods that we're talking about 1 month and then forget them. These are to be gradually added into your repertoire of food and food choices. So last month, our food of the month was beans. This month, our food of the month is broccoli. We talked about it being a cruciferous vegetable. That's in the same family as kale and spinach and cabbage and Brussels sprouts are all cruciferous vegetables. Green, really good for you, packed with fiber, packed with multiple vitamins. And it just so happens that this month of Colorectal Cancer Awareness Month, that our food of the month helps with your gut. Wow, is that a coinkydink or is that just something planned? Well, I don't know. You guys know that it's planned. Broccoli helps with our gut flora, and it helps to build our immune system. So broccoli is important. You can have it multiple different ways. I want to see out there how you are eating your broccoli. Are you eating it raw? Are you roasting it? Are you sauteing it? Are you putting it in a salad? Send me your pictures. Post them on my pages and let us know how you are consuming our food of the month. I love it for great recipes. So let me know how you are eating our food of the month. Okay, that's it. Thank you so much for keeping your appointment with the doctor. You know you have an appointment with the doctor every Thursday at 6:30 p.m. Pacific Standard Time. I hope that you learned something tonight that was new, or maybe it jogged something in your memory that you might have forgotten about. If you are not already a subscriber, I would really appreciate it if you go over to YouTube and subscribe to my channel and then hit that bell icon so that you are aware every time we go live. Thank you so much again for tuning in, and continue to think about building generational health within your family. Until next week, take care. Me, thank you, thank you. I completed my master's degree in entrepreneurship and organizational leadership. Thank you so much. It has been a really tough 2 years, but I did it. I'm finished. I finally have my degree, and I am thankful. So thank you, team. Thank you, team. I appreciate you all. Thank you guys for watching and tuning in. We'll see you next week. Keep your appointment with the doctor. If you have a question for Dr. Donna, please do leave it on my page, and I will be happy to answer the question for you.